Alice in Wonderland syndrome. Another name for Alice in Wonderland syndrome, AIWS, is Todd's syndrome. It is a rare condition that temporarily changes how the brain perceives things. An English psychiatrist called John Todd named the syndrome in 1955. The name comes from Lewis Carroll's book, Alice's Adventures in Wonderland, in which the protagonist, Alice, experiences situations similar to those that occur with this condition. There are three main categories of AIWS, which differ according to the type of perceptual disorder. The categories are type A, where the disorders are somaesthetic or sensory, type B, which affects the visual senses, or type C, which is a mix of types A and B. The authors of a 2016 article state that type A follows the original definition of AIWS, which involves people feeling as though their body parts are changing size. Type B causes more visual distortions of the surrounding environment. A person with type B AIWS may experience micropsia, where objects appear too small, macropsia, where objects appear too big, metamorphopsia, where aspects of shape such as height and width appear inaccurate, palopsia, where objects appear too close, and teleopsia, where objects appear farther away than they are. A person with type C AIWS can perceive both the image of their own body and that of other people or things around them to be changing. The symptoms of AIWS depend on its type and the person it affects. They may include distorted body image, altered perception of time, metamorphopsia, distorted perception of size. Symptoms that accompany an episode may include feverish symptoms, migraine episodes, epileptic seizures that affect only part of the brain. According to a 2016 review, the most common causes of AIWS appear to be migraines and Epstein-Barr virus infections. According to a 2014 case study, brain tumors may cause temporary AIWS. Head trauma may also be a possible cause. The course of treatment for AIWS depends on the underlying cause. If migraine is the source of the condition, doctors may suggest managing migraine through diet and preventative medication. However, if epilepsy is causing the symptoms, a doctor may prescribe anti-epileptics. If an infection is responsible, they may offer antiviral agents. According to a 2016 systematic review, doctors rarely prescribe antipsychotics because, despite the nature of the syndrome, there is no psychosis in AIWS. Antipsychotics can also increase the chances of epileptic activity, possibly making a person's condition worse. There are no formally established criteria for diagnosing AIWS, and the range of potential symptoms is broad. When diagnosing AIWS, the doctor reviews the symptoms that the person is experiencing in a manner that helps them feel comfortable. The doctor can then look for the causes of each symptom and assess how they link together. Tests for diagnosing AIWS may include neurological and psychiatric consultation to assess mental status, routine blood testing, MRI scans to provide an image of the brain, EEG, which tests electrical activity in the brain and can help doctors identify epilepsy, and additional assessments.